So I was just like, you gotta let them know that you are puking, diarrhea in the hospital bathroom where everybody else is, and that's gonna be a possible outbreak. They need to take this serious. The things that you do not like, you know, you just gotta try to make it somehow brighten your day, such as Paul's arm.
Yeah, don't remind me.
But Paul, how many times have you been asked if what you're going through is depression or anxiety? As you guys can see, we're in our favorite location, you know, where we do majority of everything, our photo shoots, our training sessions, our hospitalizations. We're in the hospital, guys. That was all a joke. I feel like some of you guys truly think what I say out of sarcasm is truth. And it's sarcastic. I'm being sarcastic. We're here because Paul has not been feeling the best. We think he could have gotten my C. diff, so yeah, it is very contagious. I mean, and we do everything in our power to make sure he doesn't get any of this, but things still happen. He has Crohn's disease, so imagine there is a part in his body that is weaker than everywhere else. So I had that condition that definitely is gonna attack his weak points. So of course, the hospital has rules because of COVID, and there's nothing wrong with it. When I was hospitalized in the beginning of February, it was only one visitor from like 9 to 9 at night.
9 to 8.
Oh, 9 to 8, and it had to be that one visitor the whole entire day.
You couldn't swap. Like, it's not like if I left, then her mom can come. No, it's just one person per patient per day.
But this hospitalization, which is in March, is different for Paul. He can have 2 guests, but it has to be the same 2 guests at all times. I cannot sleep over because, you know, they do have a little nice bed here, which I would definitely sleep in. But I know Paul wouldn't want me to sleep here because of the baby. Yeah. He wants me comfortable. I love you.
It's because I love you.
How was the ER for you?
So the ER wasn't terrible. It wasn't horrible getting in, but it wasn't easy. There were like 7 people in front of me, and they did say that there were 3 people who were stroke symptoms that go first. And I understand that because anything that has to do with stroke and cardiac issues, you're gonna get priority. That's perfectly fine. What I did not agree with was one guy came in and he looked like this was part of his vacation. He came in with a little overnight bag with stuff, and he was walking around perfectly fine on the phone. Hey, no, yeah, I just had to come to the hospital. And he's walking around, and then he got called back first. Meanwhile, I'm in a wheelchair over here, puking my guts out, coughing, throwing up, going to the bathroom, diarrhea, and I'm just like, and I'm just looking at him like, why does he get called back first? Like, you can tell he's fine. Like, he does not need an emergency room right now. So I told one of the nurses, like, listen, I can't wait out here. And they saw me, they're like, all right, let me see what I can do. And they told the nurse, and the nurse came out, looked at me, and she's like, okay, yeah, we'll fast track you a little bit because you're actively throwing up like crazy. And I also I think they thought I had COVID because I was coughing a lot, and it was because I was coughing like puking.
Yeah.
So that sucked.
That was the funny thing. I told Paul, I was just like, you need to tell them that you possibly have C. diff. And some hospitals, I have been to hospitals that literally we've been 0 or like 3 days without a C. diff outbreak. So
good and bad at the same time.
Yeah, so I was just like, you gotta let them know that you are puking, diarrhea in the hospital bathroom where everybody else is, and that's gonna be a possible outbreak. They need to take this serious. Yeah, after Paul talked to them, they were like, okay, let's do something, which was good. This is something for you guys. If you guys haven't seen our previous hospitalization vlogs, check them out. But Paul, how many times have you been asked if what you're going through is depression or anxiety?
None. I was expecting them to ask me at some point.
At least once.
At no point in time have I ever been asked, do I suffer from anxiety, depression, or any kind of mental illness? I am going to the bathroom and I am puking. These are the same symptoms that Janice came in with as well. And again, she was puking in front of them. She was using the bathroom, which at one point she was so weak she couldn't get up to go to the bathroom. We had to use one of the bedpans. And the nurse had to help and do all of that.
The nurse literally saw me crawling, like holding the IV pole, like crawling to the bathroom. Like there was nothing fake about what I was going through.
And they kept kind of just saying, oh, it's pregnancy, oh, it's anxiety, it's depression. I haven't been asked once. Not once. I'm like...
It must be nice to have a penis.
Here's another fun story. The hospitalist, so the main doctor that is overseeing everything, he is the same doctor that saw Janice.
Yep. He did not acknowledge me when he came into the room. Like, nice bedside manner, whatever.
But yeah, when Janice was in the hospital, he saw me, he talked to me, everything with her. With me, he just came in. Do you need anything? Okay, well, let's just wait to see what the GI doctor says. And I'm just like, okay, cool. That's it. Like, he, again...
No talking down to, no, are you sure this isn't anxiety? Are you sure this isn't depression?
It's honestly insane to me. And it's like, in such a short time span that this has happened to Janice and I, that within 1 month's time, we both are hospitalized. And seeing the same doctors, it's not the same treatment. It's like... This is like truly insane.
I don't understand. Paul has not been mistreated. You know, he hasn't been second guessed by what he has. He hasn't been talked down to. Like, hey, so any of you guy viewers out there, do you get awesome treatment when you go to the hospitals? Because apparently some of you guys do.
Now, the only bad treatment that I've had so far...
Oh my God, we got to talk about his arm. Let's talk about that. Talk about your arm.
So when I came into the ER, they started an IV on this arm.
I don't know if you guys could tell how humongous his arm is. Like,
and the size has gone down.
Like, you guys could see at least this dent. This does not. Look at it. It's like 3 times the size. Look at that. Okay. I don't feel like we're capturing this. Like,
the size of like my bicep on my left and right.
It's gotten better.
This is way better than what it was. Like, overnight, I know when you have the IV in your arm right there, you have to keep your arm straight. You can't bend it. So I kept it straight, and I kind of slept in, like awkward, but always keeping my arm straight. And the IV was not placed in a good angle. It was kind of like crooked, and then like the catheter was going that way, but then they put the tubing facing forward, so like the catheter was bent. And I'm like, why would you do that? Just leave it straight, but whatever. And overnight, my arm just pulled out the catheter just enough that it didn't completely get out of my skin, but it got out of the vein, and my entire arm just got filled with all the fluids.
But Paul, what was the first thoughts when he saw your arm?
Oh,
he thought he had to amputate it.
No, not that bad. At 6 a.m., the patient care technician comes in to draw some blood out. And they're going to stick me somewhere else. I was like, yeah, sure, whatever. And she's like, here, let me check this hand. It was underneath the blanket. When she takes the blanket off and I look at my arm, I was like, wait, what the hell is going on? I was like, what the fuck? I was like, no, pause it. She's like, oh, it's okay. Are you in pain? I was like, no, but my arm is 2.5 times its normal size. And like, this was a bump. It was like a ball. Like, literally, it was like, whoop, like that. I was like, what the hell is going on? The nurse comes in. She looks at it.
You thought you had to get something cut?
I thought, I was like, they're going to have to, like, give me an incision, drain this fluid out of my arm. I'm like, you got to be kidding me that I have to go through this now in this damn hospital. And they're like, no, it's okay. You just keep your arm elevated. So, like, sometimes you see me, like, I'm like this.
Yeah,
elevated. It's going down very slowly.
Very slowly.
My body's absorbing the fluids, but I also have to continue getting IV fluids because I am getting IV antibiotics, so I have to get fluids at the same time.
So he's getting fluids in one arm and has fluids in the
backed
other.
up ones here. And it was funny as hell because when they first took the IV out, like 20 minutes later, I was like, all right, let me get up and go use the restroom. It started leaking out of the part where, like, the site where the wound was, but not blood. Just perfectly clear fluid.
I was like, so you're peeing out of your arm?
I literally I felt like the cold drizzle. I was like, crap, I'm bleeding. And I looked down, no, it's just clear liquid. I was like, that is the weirdest damn thing. My elbow is crying.
Your elbow was crying. Oh, you know, there's certain things in a hospital you're not gonna like, but then the things that do happen, you just gotta laugh about it.
No, and it doesn't hurt to bend, but it feels like
weird. Does it feel like
so? I can't bend it very far.
Maybe
like,
it feels like a boob, full of liquid and fat.
It's not a fun feeling.
Really? Oh, I'm sorry.
I can't move. I can't use it. Like, I can't do anything. Like, I'm literally keeping, like, I have to hold myself up, like, on the pump. I have to grab it.
Guys, he's pretty much like a one-handed pirate right now.
Then they gave me the IV here in the center of my forearm, so I can bend my arm, but I just also am weary about it. And the tubing and everything, I'm just like,
And then he has this thingy-majigger, if you guys know what this is. It pulsates the legs. Make sure he doesn't get a blood clot.
I don't understand why they gave me these.
Seriously, I didn't even get the luxury of having them. You got a massage.
Because, like, okay, so these are like little air pump bags that pump up and down, and down, and it feels like a massage to me. But these are for typically when people can't get out of the bed, like after surgery, so that you don't create blood clots in your legs. I still get up, I go to the bathroom, I walk over here, so I am getting up several times in a day. I can walk. I'm not...
When they were putting it on him, he was saying, he's like, I can walk, I don't need this. And the nurse was like, well, at least you can have a nice massage. I was like, if that's an option, the next time I'm coming in, I'm asking for it.
Well, the doctor ordered it, but I was kind of just like, there's no need. Like,
maybe it's going to help you, you know, use the bathroom more. Like, so guys... Once again, when it comes down to a hospitalization, there are going to be certain things that you do not like and then certain things that you do like. The things that you do not like, you know, you just got to try to make it somehow brighten your day, such as Paul's arm.
Yeah, don't remind me.
Another one is, you know, even though Paul has not been asked if he has any mental disorders or mental illnesses, which is not a bad thing, but it's just like, it just shows a difference in care versus a female and a male, which I find appalling. That can be annoying. And then of course, the doctor who is seeing him was the one that saw me, and you could totally see a difference of treatment. That can all bug you, yes. But you got to see the bright side.
And there is a bright side.
The nurse that took care of me that I love is taking care of Paul today. I was so, when I saw her look up immediately, she's like, hey, Janice. I was like, it's you. And then she remembered everything when I was hospitalized. That's how close it was. And she's like, how's the baby? Oh my God. And I totally was surprised that she even remembered any information about me.
It was funny when Janice stayed here, one of the nurses that took care of Janice did the same thing. She's like, the name seems really familiar. She took care of me a year ago when I had pneumonia and E. coli.
Yeah, like some of the nurses here, I truly love them because they remember you, and it's like you're a part of their world, and it's so nice and warming.
And their bedside manner and everything, they go above and beyond. Like, truly, they are amazing.
So I'm so happy she's Paul's nurse. I told her to stay here 24/7, and if I need to pay her a little bit of additional money on the side to take care of Paul, I got her. Oh guys, this is where we end it. We're gonna take it easy and relax, because you know, hospital stays are not easy. They're hard mentally, they're hard physically, and they are stressful. So if you're in the hospital right now, take it easy, relax, and just try to find that little sunshine poking through those cloudy clouds out there. Do not forget, guys, to check out our different social media platforms. Patreons was the first ones to get notified that Paul was in the hospital. They have the most updates, which is nice. I know you guys like to see what's going on behind the scenes. They get the newest, the latest, the updated stuff. So check that out. Also, guys, we are expecting, even though Paul is hospitalized and I'm hospitalized, that does not stop our pregnancy journey at all. We are still continuing, and a lot of you guys may be a little nervous now, like, you guys were just hospitalized. Can you handle a child? Yes, it's called teamwork. It takes a village. It's not just going to be me and Paul. We do have loving family members who know about our health. They're going to be there to help us, support us, encourage us. So we are still excited for this journey, and it doesn't end here. We keep on going, we keep moving forward, and we never back down. Look at my, can't even do this right. So guys, check out our baby registry. All the help and love and support truly means the world to us. All right, guys, so for now, adieu and goodbye. Until the next adventure.